Jadę się Lorbanala się, Churchini Nishla, do Glizadalcha, Bashichin, do Sanhabithni, A Dashishay, do Churchini, A Dashinala. Hi everyone, my name is Alora Benali. I'm a CPC Prevention Coordinator at PEP, and welcome to today's training on how to properly administer Narcan spray. We will go over the signs of an overdose and what you can do to help someone in case they are suffering from an overdose. We'll also discuss the Good Samaritan law and how it protects you. And we're going to begin by going over what naloxone is. Naloxone is used to treat opioid overdoses in an emergency. Narcan nasal spray is a form of naloxone that is sprayed into the nose. Narcan is the brand name and is the same medication. Narcan is the nasal spray. Narcan can be acquired through different agencies such as Sonoran Prevention Works, the health department, over the counter at pharmacies, and it should be mentioned that they can be bought without insurance at pharmacies. Some signs to look for during an overdose include a deep snoring or gurgling sound. The person is hard to wake up or they're vomiting. They can have slow, shallow to no breathing or have choking sounds. They may also have pale, blue, or gray lips, fingernails, or clammy, sweaty skin. They can be unconscious or you're having a hard time waking them up, and they can have a slow heartbeat. Now I'll cover the steps to take when you think someone is experiencing an overdose. First, check responsiveness. Give a slight shake on their shoulder and perform a sternum rub. This technique is performed by rubbing the knuckles of a closed fist firmly and vigorously on the patient's sternum. Typically, if they are in a full overdose, a sternum rub will not wake them. If you are trained in CPR, then you are familiar with look, listen, and feel. Look for the chest to rise and fall, listen for breathing, and feel for a pulse. If you are trained in CPR, all this should only take a few seconds. If the person is still unresponsive, call 911 immediately. Now I'll go over how to use Narcan. The act of administering Narcan is very easy. 1. Remove the Narcan nasal spray from the box. 2. Peel back the tab with a circle to open the packaging. 3. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle as pictured. Then, gently insert the tip of the nozzle in either nostril. Press the plunger firmly to give the dose. Remove the plunger from the nostril. If there is no reaction in 2 to 3 minutes, or the person stops breathing again, give the second dose of naloxone in the other nostril using a new spray device. Remember that Narcan can be used 1 year after the stamped expiration date. What should you do if they don't respond? 1. Repeat steps 1 through 6 using a new Narcan nasal spray. Make sure to stay with the person. Naloxone loses effect 30 to 90 minutes after use. And perform CPR until medical professionals arrive, only if you're trained in CPR. It is normal to use more than 1 dose of Narcan on a person. I've heard from Tucson Police Department officers that the average number of doses they use on a person is 4 to 6. While you wait for the emergency response team, put the person in the recovery position. The recovery position is used to help the person should they awaken. They could possibly vomit once they come to, so this position allows them to release any vomit without it becoming a choking hazard. So some of you may be worried about getting into trouble if you administer Narcan or call in an overdose. There is no need to worry thanks to the Good Samaritan law. The Arizona Department of Health Services has increased distribution of anti-overdose drugs like naloxone to help curb the number of opioid-related overdose deaths in the state. The Good Samaritan law plays a role in this endeavor as well. The Good Samaritan law prevents individuals from suffering criminal prosecution for drug offenses when they seek out naloxone for someone suffering from an opioid overdose or when they report an opioid overdose to the authorities. Here are some common myths about naloxone, such as it promotes substance use, it sends the wrong message, can cause damage if the person it was administered to was not suffering from an opioid overdose, and requires professional help. I really want to emphasize the fact that naloxone saves lives. It has no effect on someone who is not experiencing an opioid overdose. For example, I can spray a dose in myself right now and nothing would happen because there are no opioids in my system. You also do not have to be a licensed professional to administer naloxone. Our office always distributes free Narcan at outreach events to everyone. It's something everyone should have on hand. Thank you very much for watching our short presentation, and I hope you all have a much better understanding of naloxone delivery. The CPC presents Narcan training to anyone, and the training goes a little more in depth. If you would like to hear more about these trainings, please contact Kate Meyer. Again, thank you so much for your time.